Today we're going to talk about the worry monster, what it is and how we can get rid of it. Kia ora, ko Stephanie, tuku ingoa, haere mai, welcome to Adaptive Go. Hi, my name is Stephanie. Mental health is important. I'm a patient, not a health professional and not a doctor. But mental health's so important that we need to start having this conversation with ourselves and other patients, as well as our friends and our families and the people that we know and love and trust. So mental health's important. It's important that us as patients start to have this conversation with each other and with our friends and our family, with trusted health professionals, with our GP, whoever it is that we need to have the conversation with to help us. If we feel overwhelmed at all, it's really important that we seek professional help. I'll put some links to where you can get some help below. I talked a little bit about the worry monster in a previous video that I did with Sarah from Skills New Zealand on sleep. Essentially, the worry monster is when worry is getting so big that it's causing you to start changing your life because you're worried about something. When worry is starting to turn into a monster, that means it's time to do something about it and try and get help to fix it. How the monster impacts you is personal. For me, the biggest impact was around pacing and fear that I would overpace and cause injury or cause myself more pain, and so I would tighten up my pacing narrower and narrower until my life just ended up being this really small world. Now, pacing's one of those really hard things to do. It's like walking a balance beam or trying to walk the white line in the middle of the road, which is an impossible white line that you can never see and nobody ever knows how or where it is except for maybe you, maybe. So it's really difficult to get pacing right and still live your life so that it's a full and happy life. So there are lots of other ways that the worry monster might be affecting you. It might be impacting your ability to sleep. You might end up having that same thought over and over and over again. Or it might be that the worry monster is making you edgy and short-tempered or feeling stressed. And the worry monster can attack you any time of day or night. It might make it hard for you to concentrate, or it might give you panic attacks. Now that's when your breathing gets shallow, your heart might pace, you might get sweaty, and you sort of have those feelings of impending doom. So that's what the worry monster is about. So what's interesting about the worry monster and chronic pain is that pain and anxiety or worry actually follow exactly the same, well, very similar parts of the same parts of the brain, but also the neurotransmitters, which are the chemicals that send signals into your central nervous system and your brain. Those pathways are very similar between pain and anxiety. So similar, in fact, that they're almost overlapping parts of the same system. So if we want to simplify this for a little minute, let's just have a think. When I'm in pain, it makes my shoulders tense, and if I'm going to start walking with pain, my whole body gets tense as I prepare for the pain, and I even have shallow breathing. Now, when I'm feeling stressed about something, I can get tense shoulders and shallow breathing. So they're very similar, and the symptoms are similar, and the way our body behaves is similar. Then it gets even more complex when you throw chronic illness on top of the whole system, because what happens is these same parts of our body and how it reacts to pain and anxiety and worry can make chronic illness harder, especially if you have an autoimmune disease, which gets worse when you're stressed. You know, that fight or flight response that they talk about calming down when you have a chronic illness. So trying to treat all of these things can be pretty complex. and a little bit tricky. But the good news is actually the treatment is pretty similar, or there are similar elements to it. So let's talk about some of the things that might make you feel better and help to start dealing with this worry and anxiety. So how do you kick that worry monster out once and for all? Well, it can be a little challenging. There can be some really simple things that you can do, and then you can slowly build on them over time. Sometimes it's the small things that can make the biggest difference. And like we talked about in the previous video on sleep with Sarah, each small change that you make is kind of like a building block, and it can build higher and higher until you're actually really starting to make a real difference. So one of the simplest things that probably helped me the most with getting on top of my pain and indirectly my anxiety, because at the time I didn't think I had any anxiety, the simplest thing was learning to breathe. So this was just taking a deep breath in right into your gut, and then holding that deep breath and then letting it go out, and when you breathe out, just letting your whole body go like jelly and relax. And then doing that through like micro pauses during the day, and you might do maybe 100 or 10 a day, just as you remember it. And it might be that you're in the supermarket or in a meeting. One of the simplest things, really low stress, and it just makes a big difference to your pain, and then in turn it can also help you get on top of your anxiety. So there are other few simple things like this that you can do, such as getting regular exercise, stretching, getting a good night's sleep, mindfulness. So those sort of simple kind of strategies, gratitude journals, all those things we put links to in the previous video with sleep, because it's interesting, all these things that you can do to help reduce anxiety and to help calm your body during the day, they also help you get a better night's sleep. Mental Health Foundation of New Zealand has 5 strategies for better well-being. They are connect, be active, take notice, give, and keep learning. Just picking up some of those really simple strategies and thinking about how you can apply them in your daily life will also help you get on top of worry and starting to kick that worry monster to touch. When you're feeling like it and you want to give it a go, cognitive behavioural therapy is always really helpful for dealing with anxiety. I tried a free online tool. It's called Just a Thought. Now this tool, I found it really useful. Some of the things that you had to do were a little corny, but actually if you did them and you practiced them for a whole week, then you could build on each week's session, and they really started to make a difference in my life. So it's a six-week program, but this stuff, sometimes it's really difficult to do. And this 6-week program took me 10 months. So when you're talking mental health, you're actually, it's never easy. The week that I got stuck on was the week around facing your fears. And I just didn't want to face my fears. I used every avoidance tactic I could in the book to stop me from doing this exercise. And in the end, after being really unwell last week, I finally decided that I didn't want to live with these fears, that they were getting in the way of my life and my recovery. So I finally got around to trying the week 4 exercise, and it really made a difference. And what made a difference was actually doing the week 4 exercise in combination with the week 5 exercise, and being able to run the 2 things together made it feel a little less scary, but also a way to sort of turn my fears into something a little more positive. So, you can also go and see a psychologist. They try a lot of different techniques, and they'll individualise the therapies that you need based on your history and your circumstances and what you're looking for. Some of the therapies that I found that worked really well for me were values therapy and acceptance commitment therapy. So, really with this Just a Thought program, something that took me 10 months to do, I probably should have contacted a health professional or a psychologist and worked through it much faster with them. So remember, if you're feeling overwhelmed, find someone to talk to. Reach out to a professional or your family or your friends. I'll put some links below to some websites if you're needing more urgent help or just any help. And I think as well, learn more about pain and anxiety, understand these conditions and how they interact, because knowledge is power, and if you empower yourself and give yourself the tools to make changes, then you'll be able to help yourself and heal yourself, and maybe even help some of those who are closest and dearest to you. So remember, if you're overwhelmed, find someone to talk to. It can be one of the organisations that is associated with the type of chronic illness that you have, like Arthritis New Zealand, or it can be a health professional like your GP or a psychologist. It can be families and friends, and check out these links below. There'll be something in here that will help you if you need it. Make sure you subscribe, because I'll do a follow-up vid down the track on acceptance and commitment therapy. So don't miss out, and leave a comment or give me an email if you want to reach out to adaptivego@gmail.com. I look forward to hearing from you. See ya.